Hello everyone. So have you ever experienced a dental pain which is not going away and it's tending to be more at night and maybe the tooth is sensitive to hot and cold? So if you are having any of these symptoms, there are chances that you might need a root canal treatment. Why? Because the decay in your tooth has reached the innermost layer of your tooth, which is pulp, and the nerves are involved. So what is a root canal treatment? We will try to understand that. So root canal treatment is an option, is a treatment modality where we clean your tooth from inside, disinfect it completely, shape the canals and then restore the form. Okay, we usually tend to put a cap and a filling after root canal treatment is over. Many patients have this question in their mind, how many visits are required for a root canal treatment? So it totally depends on your tooth status, how badly infected is your tooth. Okay, it can be finished in a single visit also if the tooth is mildly involved in the infection, or it might take 2 to 3 visits for the tooth to heal and repair itself. So it is totally dependent on your case. So what we do in a root canal treatment? We basically take access inside your tooth through a drills. We clean and disinfect, remove all the decay and restore it with the normal filling material, and then we place a crown over it after a certain period of time. Then many people ask or have this thing in their mind कि root canal में दांत में दर्द होगा, is the treatment is going to be painful, will I be able to bear with it? So please try to understand, root canal treatment is there to relieve your pain and not cause you pain, okay? And these days many anesthesia options are there which can help you to have a painless and a comfortable procedure where you are able to have the treatment done at your ease. Also, in some cases we don't even require anesthesia because the tooth is non-vital, okay? So it's not always required. Then we have this doubt if we can avoid root canal, and let's not do it right now. So please try to understand, the natural tooth is a natural tooth even if you try to replace it with the artificial option later. So it's not going to solve the purpose in the best way possible. So we should always try to save the natural tooth, try to make the treatment option as conservative as possible. So what if you don't do the root canal treatment or delay it? The decay is going to increase, eat away all the tooth structure, and later on the tooth is not salvageable. Then we cannot save your tooth. We have to extract it, pull it out. Then there is a missing tooth, and which even if you replace, the natural tooth is always a natural tooth which you should save. So let's talk about the precautions which we should take after we get our root canal treatment done. So whenever a root canal treatment is done in your tooth and you think that like now after having a cap your tooth structure is weakened or something like that, it's not so. Just that, of course, the tooth is more prone to get fractures, so you just need to take care that it should be capped as soon as your dentist advises you to do. That's it. Otherwise, it is as good as your natural tooth. Also, coming to the antibiotics part, like many people think we take antibiotics, the local infection is going to go, or we take painkillers and it will go. So it is just gone for that temporary phase, it is going to come back. So please don't postpone your treatment and get it done as soon as possible. We are just inviting problems, and getting it solved at a later stage will anyways cause a lot of swelling, pus, or maybe some other complications. So better sort it right now. So please don't ignore the tooth pain. Go visit your dentist as soon as possible and get it sorted. Keep smiling.